Performed an autopsy on an individual by the name of Marcel West, or Marcy West in this case.
Yes.
What time did you first, or what date did you first examine the body?
The initial examination took place on January 10th.
Was that when her body arrived at the ME's office?
No.
And when did her body arrive?
I believe her body arrived at the medical examiner's office on January 8th.
Okay. And where would the body have been stored between the time that it arrived and the time that you conducted your autopsy?
Her body would have been in the medical examiner cooler within the office.
Is it unusual for a couple of days lapse between the time of the body's arrival and the time of examination?
No.
And with regard to the first examination of her body on the 10th, what time of day was that approximately?
I believe we started about 10 a.m.
And how long did it go?
The autopsy, I believe, lasted about 2 hours. I believe we were wrapping up around noon on that day.
And what information did you have at that point?
The information that I had was limited to what the death investigator had collected while at the scene. I don't believe we had much more information from either law enforcement or other sources other than verbal reports from law enforcement.
Okay. So was it primarily based on the reported information from Mr. West?
Yes.
And what was your thought process with regard to the initial autopsy?
Can you be more specific?
What were you focused on ruling in or ruling out with regard to the initial autopsy?
In the beginning, when first presented with this death, one of the first concerns was whether or not she had a chronic seizure disorder or epilepsy. In folks with chronic seizures or epilepsy, particularly if they're not well controlled, those can result in death. So one of the first things I wanted to address was whether or not she was having chronic seizures or whether this was her very first seizure. So that question we were able to address very early. I don't remember exactly when, but fairly early within the death investigation process. Once we had established that she didn't have a chronic seizure disorder, but that we have a report of a seizure, then my next sort of questions I wanted to answer and that I did answer is to identify those things that can present as a first-time seizure in an adult. And so there's a lot of other things that we are doing that I'm investigating and documenting, but that was because the seizure was such a prominent part of her dying process. That was at the top of the list.
And when you say it was part of her dying process, her reported dying process?
Yes.
Okay. And so were you able to determine whether or not you believed Marcy died from the seizure?
Yes.
And what was your conclusion?
So after performing the autopsy, I came to the conclusion that the seizure was not due to a primary brain lesion. So in an adult who has a seizure and dies, those are almost always from a catastrophic event in the brain, which are diagnosable at autopsy. And so after I had completed the autopsy and the examination of her brain, I had excluded all of those catastrophic things that could present as a first-time seizure in an adult.
When you say catastrophic things, what sorts of things are you referencing?
So those types of things are like a ruptured aneurysm. Different parts of the blood vessels in our brain can develop bubbles, little sacs that then rupture. And those, unfortunately, they're very hard to diagnose when a person is alive. But when they do rupture, they generally kill people. So that would be one. Arteriovenous malformations in the brain are another one where the bleeding can be so abrupt that it kills a person. They have a seizure and they die. Some other things would be tumors in the brain, blood clots that travel to the brain, infections of the brain can rarely present as a seizure followed by death. There's probably a few more I'm not thinking of, but they are generally catastrophic and easy to see once we open the brain.
And did you open the brain in this case?
Yes.
And did you see any of those catastrophic events?
No.
In your 25 years practicing as a forensic pathologist, have you ever had a person die of a first-time seizure without being able to identify what the catastrophic event is, or brain lesion?
I don't recall that ever being the situation.
So when you've ruled out the seizure as the cause of her death, what are you looking at then?
So, we've excluded epilepsy, so chronic seizures. We've excluded catastrophic things in the brain, and so my next sort of area of inquiry or things I want to consider are things where there's a seizure, but the initiating process is outside of the brain. Another way to say that is that the person was dying from something else, but because of the dying process, had a seizure.
So would it be fair to say, in that case, that the seizure would more be a symptom of dying than the cause of dying?
Yes.
So what sorts of things do you look at to determine whether that?
So when opening up sort of that avenue of inquiry, the causes and the mechanisms are incredibly broad. And they generally originate outside of the brain. They can be any part of our body that malfunctions enough, our heart, our lungs, liver, kidneys. If it becomes very severe, can result in a seizure. So it's a very broad area of inquiry.
Okay. Were you able to find any process beyond the injuries that we'll discuss later that could have caused that seizure?
No.
At the conclusion of the first examination, were you prepared to give an opinion on cause and manner of death?
No.
Were you prepared to call it suspicious?
No.
Why not?
At the end of the first day, I did not make any observations and I didn't have any information to suggest that this was anything other than a natural death, and I just needed to find the answer.
Now, did something occur that caused you to want to look at the body again? Well, let me back up. So shortly after you finished examination day 1, what happened to the body?
So we finished the exam around noon on the 10th. Her body was released to the funeral home that afternoon, I think around 2:45, 2:50 in the afternoon was when her body was released to the funeral home.
Who needs to make those funeral home arrangements?
the family, the legal next of kin.
Okay, so it's not the medical examiner's office calling the funeral home saying, come get the body.
Not usually, no.
So the body leaves around 2:15?
2:45, 2:50.
And did Marcy's body ever make it off the van at the funeral home?
No.
Okay. Did the driver bring the body back?
Yes.
How long was the body gone for in total?
Her body was in transport for about, I think, 25 to 30 minutes.
And is it common for the body to have left that soon?
Not necessarily, no.
Do you have any concerns that the van ride caused any of the injuries that you ultimately documented?
I have no concerns, no.
Why not?
The way bodies are packaged and prepared for transport generally does not allow for any movement of the body, barring a major collision. There's that, but also after the autopsy, almost all of the blood has been drained from the body, and so even if there was blunt impact or any sort of impact with the body, there would not be a lesion that looks like it occurred before death. It will have a very different appearance.
And so the body came back. When did you conduct the second examination of Marcy's body?
The second exam was the following day, so that would have been the 11th. And I believe, again, we started around 9 or 10 in the morning.
And were you able to see things in the second evaluation that you weren't able to see or fully appreciate on the first?
Yes.
And why was that?
On the first day, that when we did the initial examination of her body, she had, like many people do, very dense lividity, or that pink, deep purple discoloration. That made it very challenging to see a lot of the lesions I later identified on her head and neck. Then the next day, because a lot of that blood had been drained, those areas became more prominent visually.
All right, I'm showing you what has been I'm showing you what has been marked for identification purposes as P99. What is that?
This is a composite of two images of the left side of her face. The bottom image is from the first examination. The top image is from the second examination.
And what does it demonstrate?
The two photographs demonstrate the change in lividity, most importantly, and then and as a result of that, the distinctive appearance of some lesions.
Is it a true and accurate depiction of the left side of Marcy's face as it appeared during the first examination and then in the second examination?
Yes.
Move to admit P99.
No objection. P99.
P99. All right, showing you P100.
Council, we don't use P and D if we use numbers. So.
Exhibit is number 100.
Could you repeat the question?
Sure. This is exhibit 100. What are we looking at?
This is a composite of images from the right side of the face with the top image from the first day and the bottom two from the second day.
And again, does this show the difference in lividity?
Yes, it does.
True and accurate depiction of how she appeared on both the first day of the examination and the second day of the examination
Yes,
on the right side of her face.
yes.
Move to admit 100.
No objection.
100 to
Publish.
grant.
All right, Dr. Burke, so this image that we're looking at on the left-hand side as we stare at the screen, would this have been from day 1 or day 2?
That is from the first day.
Okay. And this image on the right-hand side of the screen?
That one is from the second day.
And when you say the difference in lividity, is that this red discoloration on the left side of the screen?
On the cheek, it's red. On the portion of her neck there, it's a red to almost a purple.
And that had dissipated to some extent on day 2?
Yes,
And the exhibit number come?
99.
99 you're on? 100. And then 100 next. All right, Dr. Burke, so this photograph on the upper left-hand side as we stare at the screen, is that day 1 or day 2?
That is from the first day.
And on the right-hand side of the, upper right-hand side of the screen,
That's from the second day.
and the bottom.
Yes, that one is also from the second day.
And again, does it depict less lividity on day 2?
Yes.
Right. So you're able to see external injuries better than on the second day. Is
Yes.
that accurate? Okay. And can you describe the difference between the first examination and the second examination with regard to the internal structures of the neck?
Are you asking about the procedures I did?
Yes.
Okay. So on the first day, I did a very standard autopsy. That involves examining the structures of the mouth and the neck. In order to do that, what we have to do is take the skin from the chest and it's called reflecting, where we take the skin, we don't remove it, but we open it so that we can see the neck and the base of the tongue and the salivary glands. So on the first day, we removed what's called the neck block. It consists of the tongue, the larynx, and the esophagus. So that all was removed and examined on the first day. On the second day, what I did was I opened the skin between the bottom of the dermis and the adipose tissue, the fat layer. So we all have a layer of fat that's sort of our cushioning between our skin and our other structures. And so typically, normally in a normal autopsy, those two come up together. But what I wanted to do was to look between the skin and the fat. So I opened that and looked at it. After I did that, then we then we went back to what we had done the day before, which is to document all the changes in her neck and to photograph them and measure them.
Was there additional dissection of the neck?
A little bit. So the additional dissection involved taking this skin flap piece. Normally we stop right below the jawbone. In order to photograph the under the jawbone, we took it up, I took it up just to the edge of the jaw so that we could photograph this part. And then after that, we don't normally open the carotid sheath, but I opened the carotid sheath as well along its length.
Okay. And why is it that you don't normally take the skin up above the chin?
The reason we don't do that is we run the risk of damaging structures that the funeral home will use to prepare the body for a viewing. And so there's a balance that we try to maintain in seeing as much as possible, but also not impeding a viewing for the loved ones.
And so when you took the skin up above the jaw, did that make it easier for you to visualize some of the internal injuries?
Yes.
And can you describe the difference between the first examination and the second examination with regard to the back of the head and scalp?
Yes. On the first day, I observed a bruise on the back of her head on the left side that was over the bone. There's a bit of bone that's a little bit of a, I'm gonna call it a nodule, but prominence. So I noticed a bruise there. On that first day, I stopped. I did not examine that further, so I stopped with the dissection right at the base of the skull. On the second day, again, we call it reflecting the skin. So I extended the incisions down the back of the neck, and I traced this bruise as far down as it went, which was down onto the neck part, not the skull part.
So starting with your external examination findings, did you observe any injuries to Marcy's head or neck externally?
Yes.
What did you see?
So the injuries that I observed were some petechiae, little tiny areas of hemorrhage in her eyes, on her cheeks, and on her neck. Behind both of her ears were bruises, contusions, and then on both sides of her neck, in addition to some very small areas of petechiae, were very faint bruises.
Can you describe the bruising that you observed behind the ears?
The bruising behind her ears was in this place that has a couple of different names. It's where the earlobe meets the jaw right in front of the skull. So it's this depression behind the earlobes right next to the jawbone. A lot of people are familiar with T and J, so just right in that depression is where those were. On the right side, the bruise was a deep purple. And it had these very tiny areas where the skin had been rubbed off. On the left side, the bruise was a deep purple color. It was smaller than the one on the right, and it didn't have any of that, the rubbing characteristics that the right side had.
Can you describe where the mastoid region is generally anatomically?
Yeah. So the mastoid region is in that same area. The mastoid region is this bony area behind the ear, what we call the helix, the ear helix, this bony region. So that's the mastoid region.
Is that region behind the ear have a lot of blood vessels? Doesn't it?
Yes, it does.
Okay. And is bruising behind both ears a common accidental injury?
I will say bleeding behind the ears, both from bruising or from blood leaking, does show up behind the ears.
But is it at a place where people typically would have an accidental injury?
It's a relatively uncommon place to have an accidental injury.
Is it something that could have been caused by CPR or chest compressions?
Objection, no foundation.
All right. So, show you Dr. Burt, I'm showing you what has been marked as 151, an illustrative exhibit. What is that?
This is an anatomic diagram rendering of the left side of the head without the skin. So the blood vessels and the muscles are identifiable.
In understanding that it is an illustration, is it generally anatomically accurate?
Yes.
We would admit for illustrative purposes, 151.
No objection.
All right, 151 is admitted for illustrative purposes. When an exhibit's admitted for illustrative purposes, it's used to by the witness during their testimony. It does not go back with you to the jury.
All right, and then I'm going to show you 119 through 121 inclusive. Can you take a look at those? What are those?
These are photographs from the examination on the second day of Marcy's, the right and left sides of her head about her ears.
Are they true and accurate depictions of the areas on Marcy's ears during the autopsy?
Yes.
We should admit 119 through 121.
No objection.
119 through 121.
Yes, thanks. Okay. So, this is what is an illustrative exhibit. Let's see, 151. So, can you describe for the jury what it is that we're looking at here?
This is a view of the left side of the head, with the left ear, and the face is a little bit out of our view. Most of what's visible is the back side of the head in this image.
And now, is it possible for jugular compression to result in bilateral bruising behind the ears?
Yes,
Can you explain that process for the jury using this study?
the jugular vein is the vein that drains the head. When the jugular vein is compressed, blood will collect in the veins that are uphill from it. If the pressure gets high enough, blood vessels can rupture, or they can just become very dilated. And then when we look at it from the skin surface, it looks like bruising behind the ear, because there's a number of veins that drain from this side of the head into the jugular vein. So although we call it bruising, it looks like bruising, but it's not necessarily from blunt trauma. It can be from the blood vessels just being really, really congested and then leaking. So that's how compression of the jugular vein can create the appearance of an injury in that part of the head.
And can bruising behind the ears also be caused by directed trauma from the outside?
Yes.
How is that?
Bruising in this specific location behind the ears and on the sides of the head can be from skull fractures in very specific locations where the blood then travels from those fractures to this area. There's very little fat tissue and muscle tissue, and so any blood that collects there is really easy to see. And so with skull fractures in certain areas, bruising right there can be one of the first indications of a fracture before the person makes it to a CT scan or an MRI scan.
Can it also just be from like some sort of hard force?
Yes, it can also be from just a traditional impact that ruptures blood vessels.
So it could have an internal or an external cause or both.
Yes.
We go to first photo. Okay, so are we looking at the right or left side of Marcy's head in this photo?
This is the left side.
The exhibit number.
Apologies, Your Honor.
119.
119. Okay. And what do we see in this particular photo?
The two lesions that I documented were a linear pattern of petechiae in front of the ear there.
Is that what I'm looking?
Yes, that line of petechiae there. And then some very tiny bruises just below the earlobe there, yes.
Am I pointing to the correct place?
Yes, those are the bruises, yes.
Okay. And if we could go then to 120. Right, is this that same ear?
Yes, it is.
Okay, and what are we looking at?
So this is with the earlobe and the ear helix pushed forward so that that area behind the earlobe is visible, and there's that dense purplish blue discoloration, which is a bruise.
And that's what we're looking at?
Yes, that is it.
Is this the same mark that we saw below her ear in 119?
Yes,
And again, this is the left side of her head?
yes.
If you go to 121. Is this Marcy's other ear?
Yes, it is.
So the right side of her head?
Yes.
And what are we looking at here?
So this is that area behind her earlobe that's demonstrating that purplish blue bruise. And then the very tiny areas where the skin has been rubbed off. Yes, those. Also, in front of her earlobe are two red spots. Those are petechiae there.
Is that the here and here?
Yes.
And again, it's your opinion that these are abrasions?
Some of those are abrasions. Some of those are just deeper colored bruises. So towards the tip of her earlobe, those are bruises, whereas if you go down and backwards, that's an abrasion where the skin has been rubbed off.
So do you have an opinion about whether this particular constellation of injuries resulted from internal injuries, external injuries, or both?
Whew. I believe the bruising is from an external injury. The petechial hemorrhages are more challenging. They are in a distribution that could be from local compression of the blood vessels, but they could also be from increased pressure in the blood vessel distant from that caused them to rupture.
Right, and we've talked a lot about petechiae. Did you observe petechiae on Marcy?
Yes.
And what is petechiae?
Petechiae is a word to describe an area of hemorrhage that is tiny. Different textbooks have different definitions. In general, it's an area of hemorrhage that is less than 3 millimeters. The term petechiae does not necessarily tell you how it came about, just that it is an area of hemorrhage. But in general, petechiae happen when there is enough pressure inside the blood vessel to cause it to rupture, and then blood leaks out.
And how do you determine whether a spot is petechiae versus a normal skin imperfection?
Most red skin imperfections are clusters of blood vessels that are just visible from the skin surface. And so the easiest way to differentiate the two is to push on the area of redness. If it's a skin imperfection from a cluster of blood vessels, they will generally blanch, or the blood will squeeze out, and then it will refill again. Because it's in the blood vessels, it can move. Whereas a petechia is blood that has leaked into the tissues, and by pushing on it, you're not going to change where the blood is. So that's the easiest way to tell the difference.
Okay. And what causes petechiae?
So petechiae result from the rupture of blood vessels. Every bruise is rupture of blood vessels, and blood leaks out. Petechia are just the super tiny blood vessels that rupture by themselves, and then we can see them as little tiny dots.
What does petechiae indicate to you, generally speaking?
In general, petechiae mean there's been an increase in the pressure in the blood vessel. That's what they mean.
Now, on Marcy, was there a lot of petechiae or was it more limited?
I would say it was very limited.
And are petechiae present in every strangulation death?
No.
Can petechiae be limited or even absent in some forms of neck compression?
Yes.
Can petechiae also be caused in other ways,
Yes.
including vomiting?
Yes.
So would it be fair to say that it's corroborative of a strangulation event, but not necessarily conclusive on its own?
Yes.
Great, Dr. Burt. Handing you 99 and 101 through 116. Take a look at those for me.
I do. These are images from the second day of examinations at the outside of Marcy's body.
And with the exclusion of the first image, which is 98,
Yes.
do those images depict what you observed as far as petechiae?
Yes, they do.
And are they true and accurate photographs?
Yes.
Right. This time move to admit 98 and 101 through 116.
16. Do you have any objection, to any of the documents?
Object to 106 and 113.
On what basis?
They're altered photographs. They do not, they're not original photographs. They've been altered.
I can
Okay, 98 and 101 through 105, and the other images up to 115 except 113 are admitted.
All right, what is this that we're looking at here?
This is a photograph taken during the examination of one of her eyes. We don't always take our photographs so that they're easy for other people to orient. So for everyone in the room, that is upside down.
Okay, so, right, so, where I'm pointing here at the base of the photograph, that would be the top of her head,
That's correct.
and this is where her chest is, right?
Yes,
On the top.
yes,
Generally speaking, with regard to these measuring devices, do they, are they oriented so the writing is, the top of the writing is facing the top of the head?
yes,
All right, so this would be her left eye, is that accurate?
yes.
And what do you see in this eye?
So in this image, at the lateral part of her eye is a very small red area.
Is that where I'm pointing here?
Yes,
And what do you believe that is?
that is most consistent with a petechial hemorrhage.
And 102. All right, again, we're upside down. So top of her head is here at the base,
Yes,
correct? And this is her mouth at the top?
yes.
Okay. And this is a photograph of.
This is a photograph of the inside of her upper eyelid. And there's a very dark, almost linear looking area of hemorrhage on the inside of the eyelid.
Okay, is that where I'm pointing here?
Yes,
And what do you believe that is?
it's hemorrhage and it's surrounded by tiny hemorrhages, which would be petechia. That's large enough that we wouldn't call it a petechial hemorrhage, but it is hemorrhage.
Do you have an opinion on what the cause of this hemorrhage is?
Only in very general terms.
What are the general?
Objection, relevance. Overruled.
So an area of hemorrhage on the inside of the eyelid of that size and shape is most consistent with a blunt impact to that region.
And then you indicated it was surrounded by petechia?
Yes,
All right, 103. All right, what are we looking at here?
this is the right ear and the part of the cheek that's just in front of the right ear. So we have the earlobe that's visible and then the ear canal. And then just in front of that are two red dots, and those are petechiae.
Is that where I'm pointing here?
Yes,
Okay. And 104. Is this just a closer view of those two petechia dots in front of her right ear?
yes.
All right, 105. Okay. What are we looking at here?
This is the right side of the lower part of her face and the right side of her neck. And the ruler is framing a oval, crescent-shaped, roughly crescent-shaped area of petechial hemorrhages.
Is that what this is here?
Yes.
Is there anything else noteworthy on this particular image?
There are other petechial hemorrhages that are a bit washed out in this photograph, but on the right side of her jawline is a very small cluster. Yes, in that region, yes.
Okay. And then these are the two that we previously identified in front of her ear?
Yes.
Okay. Now, these are somewhat faint. Did you put or develop another slide with black dots placed on what you observed to be the petechiae?
Yes.
So now I'm showing what has been admitted for illustrative purposes only, 106. Okay. So is this a copy of the same photograph we just looked at,
Yes.
which is 105? And these black dots that are here, did you place those?
Yes, I did.
And are those placed on top of what you identified as petechiae?
Yes.
Okay. So specific to this region here on the neck, do you find any significance to the formation of the petechiae?
I can say that it is consistent with and not consistent with certain things,
Okay.
but I can't tell you exactly what it is.
Would it be consistent with a finger?
Yes.
And is it placed, where is the location of this particular crescent-shaped cluster of petechiae?
That particular distribution is at the anterior edge, so the front edge of the big muscle that comes down the side of the neck. So it is just in front of that muscle on the side of the neck.
And did you identify a hemorrhage in this particular location?
Yes.
And was that the hemorrhage to the carotid sheath on the right side?
Yes.
Okay. Now, petechiae can be developed by restricting blood flow, correct?
Yes.
Can it also be from direct pressure?
Yes.
And let's see, move on to. Got a little bit out of order here. Okay. All right, moving on to 107. All right. Which side of Marcy's face is this?
This is the left side.
And do you see anything noteworthy in this particular photograph?
In this photograph, although very faint, there is a linear distribution of petechial hemorrhages just in front of her left ear.
Is that my pointing here?
Yes.
Okay. And is there any significance about this formation of petechiae?
Yes.
And what is that?
The distribution suggests that the skin was pinched in that area to create a linear distribution of injury.
Now, if petechiae had developed from, say, vomiting, would you expect for it to develop in this particular formation?
No.
What sort of formations would you expect to see?
With vomiting or sneezing, what I would expect to see is a generalized distribution of petechia across the face. In those situations, the petechia are easiest to see around the eyes and on the eyeballs, but they can be across the cheeks or down the neck.
but they're generally more dispersed and generalized.
Yes.
One oh eight. All right, is this just a closer view of those same linear petechiae on
Yes.
the left-hand side?
Yes.
One oh nine. All right, what are we looking at here?
This is the inferior surface of the left earlobe, where there's two small red dots.
Is that here and here?
Yes,
And what do you believe those are?
those are most consistent with petechial hemorrhages.
Any significance to the location of those?
Not specifically, no.
All right, showing 110. All right, so we're still looking at the left side of Marcy's face, correct?
Yes,
And this is the linear formation of the petechiae here.
yes.
And what is this here?
That is a small cluster of bruises that are just below the left earlobe.
111. All right, what are we looking at here?
This is the left side of her neck. For reference, her left ear is at the bottom right corner. And then her jawline, I know it's really hard to appreciate, but it would be diagonally across that. Yes,
Like that?
no.
Okay.
It would go from the corner of the ruler
Uh-huh.
more towards her ear canal. So
So from here, like this?
yes, that would be her jawline.
Okay. And is there anything significant on this particular photograph?
Yes, on the part of her neck that's closest to the 2 and 3, there's a very faint bluish contusion, so bruise, and within that is a cluster of petechial hemorrhages.
And where is the location of this bruise? Could you just show the jury on yourself?
Yeah. So this is on the left side. So it's again in front of this large muscle right here, just in front of it, and then below the ear.
And is the location of this bruise over the carotid artery?
Yes.
One 12. All right, so in this particular photo, we have the same linear pattern of the petechiae, contusion that we just talked about, bruise. Is there anything in addition to those two things in this particular photograph?
Yes.
And what is that?
A little bit lower and more towards the front of her neck is a cluster, another linear cluster of petechiae that's a little bit on a diagonal orientation. Yes,
Is that where I'm pointing here?
yes.
Okay. Do you find any significance to the pattern of that portion of the petechiae?
Not specifically, no.
All right, now, 113, is this another situation where you put black dots over what you observed to be the petechiae
Yes,
to make it easier to see?
yes.
And publishing 113, which has been admitted for illustrative purposes only. All right, so in 113, we have the black dots. Is that what you observed to be the petechiae just next to her ear?
Yes,
And then down here lower, that's the linear pattern of petechiae on her neck.
yes.
And then this here was the bruise.
Yes.
Anything else that's noteworthy about this particular photo?
No.
Right, 114. Is this a close-up version of that linear pattern of petechiae on her neck?
Yes.
All right, 115. What are we looking at here?
This is the left side of her cheek and the part of her chin just below her lower lip. There's a red, pinkish red area of skin discoloration with, yes, that also had a bit of a rough or flaky texture to it.
And what did you determine the likely cause of this was?
That is most consistent with a very minor superficial skin infection, sometimes referred to as impetigo.
So we don't necessarily think this is related, or this isn't indicative of any sort of a strangulation event or trauma.
No.
And 160. Right. What are we looking at here?
This is the inside of her scalp. So in order to remove the brain, we have to invert the scalp. So this is the part of the scalp that sits right next to the skull. And in this image of the inside of her scalp are a number of deep red, pink to deep red spots.
And what is the significance of those to you?
These are hard to assign significance because this type of change is common in a lot of different types of death. So it is not unusual when a person dies for their scalp to become very congested and to look like this. But it can also be indicative of blood that has pooled in the head for other reasons.
I muted, but I caught it this time. So that was the ME on direct examination. We have never seen her cross examination. They ended it, originally we only had her direct. So now I am going to get queued up her cross examination. Let's see what the defense tried to say.
And you indicated that you performed an autopsy.
Shirt shows you this. Oh, my feet are just aching, and so then I would.
Yeah, because I was like, I couldn't understand, and I know that the state did not cross certain people when we were looking at the case. But I really found it funny that I know that a lot of the dispute in regards to the way Marcy passed away had something to do with
marriages have their ups and downs. Did your marriage have its ups and downs?
If she was strangled or not, right? So the defense definitely wants to talk about that.
There was,
So let me get it up here.
the ups and downs. We had so many good times. We have so many good memories and happy memories of raising the kids.
You mentioned yesterday that you want to do the autopsy as quickly as you can, right?
Within the constraints of the resources we have, yes.
Well, sure, ideally, you'd want to do it right away if you could, isn't that right?
There are a lot of variables to consider in that question.
You did the first, well, first of all, why do you want to do it so quickly? Why is it important to do that early on?
Can you define quickly?
Sooner than later? Why would you do it the next day rather than 3 months later? Why would that be a good idea?
Even with refrigeration, the body does go through the decomposition process.
And, all right, so now you did the first autopsy on the 10th, you say, correct?
Yes,
And you started that about 10 in the morning, you said?
about, yes.
And then the second one was on the 11th. And when did you start that one?
I believe about 10 a.m. as well.
When did you finish that second?
I believe we probably finished in the afternoon.
2, 3? How many hours would it take?
I don't exactly recall the afternoon.
How about the first one? How long was that?
I believe we were done within about 2 hours.
Now, and then you completed your report on June 24th of 2024, correct?
Yes,
And that's because you're waiting for the toxicology report.
the toxicology report had been received, I believe, in March.
Now, when you first did the autopsy, you're doing the work and you're giving instructions to someone who's taking notes, correct?
There's a team of people that assist me.
Well, let's just talk about this particular one. You did the work and you're telling a tech basically what to write down. You're making comments and they're writing down your comments, correct?
During portions of the exam.
And someone else took photos. You didn't take the photos.
Yes.
Who took the photos?
I would have to refer to the photographs to address that. I don't exactly recall who took the photographs.
When did you first look at them?
The photographs?
Yes.
Probably within a day or two of the examinations.
And then you, within a day or two, the first or the second examination?
Both.
And then you looked at it again when you wrote your final report in June?
I suspect I looked at them a number of times between the exam and I finalized my report.
You know, you misspelled her name. You know that, correct?
Objection relevance.
The spelling of her name is what was given to us through documents.
You referred to her as Marcel instead of Marcella. You know that, correct?
I am not aware of the pronunciation of her name.
But is Marcel the name that's actually on the final death certificate that you issued?
I am not in control of the demographic information that is on a death certificate.
Are you not responsible for your own report that you write?
I do write my own report.
Now, you say that when you finished the first time, you finished after a couple hours, so maybe we're about noon, 1 o'clock, something like that?
About,
And somebody came to get the body, right?
yes.
When did they get it?
I believe the funeral home representative came about 2:45 or 2:50 in the afternoon.
Okay, who was the funeral home representative?
I do not know.
What standards do they use for transporting bodies after autopsies? Do you?
I'm not aware of those.
Now, you say it's not uncommon to re-examine the body, right?
Yes,
But that's usually, ideally, when they're still there and they're in the cooler, you can take it out and look at it again, right?
yes.
Okay, so sending it off with, some individual you don't know to go off for a few hours and then come back, that's probably not best practices, is it?
I would agree with that.
Doctor, I'm going to show you Exhibit 101. You saw this earlier, and I think you identified that, correct?
Yes,
Now this, I'll just show you for a minute. There's a lot of like bloodshot eye right there, correct?
I would call those congested blood vessels.
And that's on the white part of the eye.
That's the the sclera or the conjunctiva.
Okay. Some people say conjunctiva, is that right?
Yes.
Now you didn't notice any discoloration or bruising on the front of her neck.
Can you define the front of her neck?
The anterior side of her neck.
The neck is curved, so there was some bruising that I would consider anterior lateral.
I'm showing you what's been marked as exhibit 1.
Okay.
Doctor, this one, you say shows some kind of bruising, maybe a little bit of abrasion on the back?
Yes.
It's kind of dark, isn't it?
That is one way to characterize it.
And that would suggest that maybe it's been there for a while.
Can you define a little while?
It looks like the blood has coagulated, correct?
I can't speak to the coagulation status.
And it looks like if there's bruising, that means that the heart was still beating and that it may have happened at least sometime before she passed away, isn't that right?
Yes.
Doctor, I'm showing you what's marked as exhibit 122. Just ask you to look at that again.
All right.
I think you mentioned on direct examination that some of these are artifacts, correct?
They may be artifact.
Okay. And don't they also line up with the things that you identified as injuries?
They do not.
Okay. Does this not fold up and meet this part right here?
It does not.
So you're saying that the two shadows at the bottom,
I would ask Your Honor that he allow the witness to see where he's pointing.
okay, well, that's public. Okay. So I'm referring to the two darkened areas at the bottom, which you referred to as possible artifacts,
Yes.
which means it might be something that you did perhaps during the process. Is that right?
Yes, potentially.
And then we're looking at the upper portion where there's a couple areas that you've identified as injuries, correct?
Yes.
And so the ones on the lower portion, that was actually kind of severed and pulled down from the upper portion, correct?
No.
And so they kind of meet up, don't they? Common sense would tell us that.
I'm not sure what you mean by meet up.
In your testimony yesterday on exhibit number 123, you said you couldn't say what caused that little red dot.
That specific one, no.
Okay. So sometimes a red dot is just a red dot, is that right?
Sometimes it is indeterminate between artifact and injury.
I'm showing you exhibits 144 and 145.
Okay?
And the purpose of those was to show that there's some bruising on her elbow, correct?
Yes,
And again, they're darkened, correct?
that is one way to characterize them.
Well, how would you characterize them?
I would characterize them as contusions.
Okay. Darkened contusions?
It's a relative term.
Okay. And that again would suggest that it happened sometime before she passed away. No way to age them, could be hours, could be days, correct?
Yes.
And we don't know how these occurred, do we?
I do not have a mechanism by which they occurred.
She could have bumped her elbow.
Yes,
She could have fallen against something, the counter or something like that.
yes.
I'll show you exhibit 306. That's particularly. Does that look familiar to you?
Yes, it does.
And that features the Lucas bruise, doesn't it?
It features an imprint and an abrasion created by the Lucas device.
And that's fairly dark, if I could use such a word. It's fairly dark in the center, isn't it?
Again, dark,
Council, what number is the exhibit?
This is exhibit number 306.
Has it been admitted?
Does that fairly and accurately depict the injury that you saw when you did the autopsy?
I would not characterize it as an injury.
Does it fairly and accurately represent that portion of Marcy's body the day you did the autopsy?
Yes.
Okay, move to admit exhibit 306.
Can I see it?
Yeah.
It's a black and okay.
306 is admitted.
Okay, so that, if I dare say, that darkened portion would be a bruising, wouldn't it?
It's not a bruise.
What would you call it?
There is an imprint where there is relative change in the skin color. There is an abrasion like crescent where the skin has been rubbed off. There's no corresponding contusion associated with that.
You don't see any darkened area around it?
That is discoloration. When we open up that skin, there's no definitive leakage of blood that would qualify it as a contusion.
You're aware that the Lucas has a suction cup on it?
It may have.
Well, does it or doesn't?
I'm not familiar with every Lucas device.
You're not familiar with the fact that the Lucas has on the end of the plunger, it has a suction cup that attaches to the chest.
It may have.
That would help bring the chest back, wouldn't it?
I am not familiar with the detailed mechanisms of a Lucas device.
Doctor, I'm showing you what was entered yesterday as exhibit 154. Just ask you to take a look at that, please.
Okay.
Where would the vertebral arteries be?
The vertebral arteries in this cross-section are not accurately depicted because this particular cross-section is using a thoracic vertebra, not a cervical vertebra, which is where the vertebral artery travels. This particular cross-section is below the level in the neck where the vertebral arteries enter the vertebra.
Now, the vertebral arteries, that's just another blood supply for the brain, isn't it?
It is.
You get blood supply from the carotid arteries, you get blood supply from the vertebral arteries that are kind of right by the vertebra, right?
Yes,
Okay, and they're protected, aren't they?
they are.
So when you, this naked rear chokehold you were talking about, you're not squeezing those, are you?
No.
I'll show you what's been marked as exhibit 307. Let's ask you to take a look at that for a second. Before you say anything, this is being admitted for demonstrative purposes. Council, I gave you a copy.
I don't have a copy. You just looked it up online.
Okay. Would this assist you in demonstrating to the jury where the vertebral arteries are?
Potentially.
Move to admit exhibit 307 for demonstrative purposes.
I could just ask a clarifying question. Is that an accurate illustration?
No.
I would object.
It's just for demonstrative purposes.
Well, the purpose of an illustrative exhibit is to allow the witness to explain whatever testimony or questions you're going to ask her. If she doesn't believe it allow her to do that, then nothing.
Does this diagram show you roughly where the vertebral artery will be located relative to the spine?
In very general anatomic locations, it is a general anatomic location of the vertebral artery.
Would it assist you in explaining generally where the vertebral artery is to the jury?
Maybe,
Potentially?
potentially.
Move to admit.
Admitted for illustrative purposes.
So, Doctor, that red dot shows it being kind of protected by the vertebra, correct?
In that image, it is near the vertebra, which is not exactly how it is in the body.
Does it change relative to the vertebra as it travels up or travels down?
The relationship does not change from what is depicted there.
Does it at least explain why it might be protected from a squeeze like that?
Potentially.
Okay. Move to publish, Your Honor.
Well, if you're publishing it to allow it to explain testimony you're asking her to give,
Yes.
okay, well then have her step down and show what it is you want her to show.
Okay, well, can you step down, please, and show the jury where it's located, how?
So in this image, this is a cross-section of the neck, very similar to the one that we looked at yesterday. The front of the neck is here, and then the back of the neck is here. The vertebral artery is next to the vertebra. On both sides, there's two that travel up the back. And so in this diagram, it shows the relationship of the vertebral artery being next to the vertebra, which is sort of this tannish structure here. So each vertebral artery sits right next to bone on both sides. And so as it travels up, when it is next to a vertebra, it's protected. There are gaps between the vertebra where it's unprotected, but when it is next to bone, it's protected.
So I'm going to show you Exhibit 155 that was used yesterday. You recognize that, right?
Yes, I do.
And would that artery be protected during this move?
It is.
So in other words, even though you've cut off blood supply, let's say you occlude the carotid artery, correct? You still have a blood supply going to the brain, don't you?
There is blood flowing to the brain.
And that, I'm going to ask you about Exhibit 166. Same question, would it be protected in that move?
Yes.
And so again, you'd have continued blood flowing through the vertebral artery to the brain, even though the carotid artery is occluded, correct?
Yes.
And that has the effect of building pressure, doesn't it?
It can.
Well, if blood is pumping in, and let's say the jugular is cut off, it's not going to come out, is it, for the most part?
Blood will continue to flow in as long as the heart is beating.
It's going to continue to build pressure.
Yes.
And you said that if this rear naked chokehold you're talking about, if it's applied just right, not too much movement, avoid the hyoid bone, you're saying that it could cause unconsciousness in just maybe 10 seconds, 20 seconds?
Yes.
But now, in order to cause death, we're looking at more like 5 to 10 minutes, aren't we?
Yes.
That's 5 to 10 minutes of no blood coming out, blood going in, pressure, pressure, pressure. Is that what you're suggesting? Is that what would happen to cause death? Is that the situation?
No.
Isn't it true that if you cut off the blood supply for 10 minutes, you're going to have massive petechia?
No.
You're going to have a pretty clear line across the neck where there's no petechia below it, and above it, you're going to have a whole bunch of scattered petechia.
No, that's not what I'm testifying to.
What are you saying would happen? If blood is going in and causing petechia, why wouldn't you get massive petechia?
So I'm not testifying that I agree that blood will continue to flow in through the vertebral arteries. And I agree that there is some increase in pressure. The vertebral arteries through the basilar artery supply so little blood to the brain that the person dies from lack of oxygen to the brain before there is sufficient blood buildup in the brain from the vertebral arteries.
You've seen people hang themselves, correct?
Yes,
Don't they have petechia in their face?
sometimes.
So now you're saying that this demonstration you gave yesterday with these diagrams, this is Exhibit 155, you're saying that wouldn't necessarily cause petechia?
It can.
So what you referred to as petechia, that you said petechia-like, could be petechia, you're saying that doesn't necessarily support the theory that she was strangled to death by a rear naked chokehold?
Can you repeat the question?
You testified yesterday that the injuries you saw were consistent with this rear naked chokehold. Remember that?
Yes.
Okay. Now you're saying that, well, maybe petechia doesn't support it.
It does.
But you said it was petechia-like, correct? You're not positive because you never cut into them, you didn't verify that they're petechia. Correct?
My opinion is they are petechiae.
And petechia forms within seconds to minutes, correct?
They can.
Now, the contusion that we saw, this is in number 137, you said that that would not cause death, correct? That's not necessarily something that would cause death.
Yes.
Now, you said that you were unable to think of any external forces or external causes that would have caused death, so you deemed it a strangulation and homicide, correct?
In general, I agree with that statement.
What if the person was nauseous, felt ill, had a massive headache, fell down and hit their head on the toilet? Would that point explain the contusion?
Objection relevance?
That is one scenario to explain the contusion on her head.
Thank you. They got dizzy and fell and hit their head on the bathtub, same thing. Possible explanation for the contusion, correct?
It is a possible scenario.
Basically, having a fall and hitting your head on any hard object that could cause that, that's a possible explanation.
Yes.
We talked about this a little bit yesterday, but not quite this same thing. You examined 8 different tissues under a microscope.
Yes.
That must have taken a while. How long did that take?
I don't have a specific recollection of the time it took.
Well, you did all the cutting and examination, all the dissection within 2 hours, and you examined 8 different kinds of tissue. How long do you think you spent on the tissue, just examining it under a microscope?
The examination of the tissues under a microscope is a separate process that takes place several weeks after the autopsy.
How long did it take you to do it when you did it?
I don't have a specific recollection.
How long would it take to examine one tissue sample?
It's highly variable and it depends on the tissue sample and the potential pathologies that are in that tissue.
10 minutes, 20 minutes, 30 minutes?
It's highly variable,
Well, give me an example. How long could it take?
as long as it takes. I can't give you a definitive answer. Sometimes it's 5 minutes, sometimes it might be 20 minutes.
I'm going to show you what's been marked as Exhibit 309. This is just for your own information. On bait stamp 496. There's a note next to brain. What does that say?
Sorry,
Objection.
counsel, are you asking the witness to read from an exhibit in the presence of the jury?
Strike the question. I'll ask a different question. There's an entry that has an arrow from the brain that says NP.
Would object, Your Honor.
Sustained. If you wish to have an exhibit read into the record, you need to have it identified and admitted.
You planned originally to send the brain for testing with the neuropathologist, did you?
Yes,
And that would have just been a request and sending off a sample, isn't that right?
not a sample.
You just sent the whole brain.
Yes,
So that would have required just boxing up the brain and sending it off to the lab with a request, correct?
it's a little more complicated than that.
Well, sure, but essentially, isn't that what you do?
Simplifying the process, yes.
To cut into a suspected petechia-like spot, how long would that have taken to put that under a microscope and look at that?
The removal of the tissue takes a certain amount of time. That tissue then goes to a laboratory, and that process takes a week to several weeks. The tissue comes back, and I look at it under a microscope. Which part of that process?
Well, how much of your time would it have taken?
It's variable.
20 minutes, 30 minutes?
Can you specify which part of that?
Okay. You take the sample, you make the cutting. How long does that take?
It depends on the part of the body that I'm cutting into.
10 minutes, 20 minutes?
It's highly variable.
So you make the cutting, which is highly variable, then you want to package up to send to the lab. How long does that take?
Anywhere from several minutes to 10 minutes.
And you are not able to say how any of the injuries occurred, is that correct?
Yes.
So there's no dislocation or fracture of the hyoid bone.
Yes.
And that's a little bone that sits right about here, kind of goes up and down when we swallow.
It's significantly higher in the neck.
Forgive me for not knowing my anatomy better. You didn't see a fractured thyroid cartilage.
Yes,
You didn't.
I did not.
You didn't see a swollen tongue.
No.
That could be an example or an indication of this asphyxiation.
I am not familiar with swelling of the tongue as an indicator of asphyxia.
Is this something you look at?
Yes.
What does it indicate?
Generally, swelling of the tongue indicates an anaphylactic reaction.
You didn't see any what you'd call defensive wounds.
I do not use the term defensive wounds in my reporting.
Okay. So all the work you've done supports the theory that she was strangled with a rear naked chokehold. Is that right?
The injuries I documented are consistent with that.
All right, that's all I have.
Redirect?
Are the injuries that you documented only consistent with a rear naked chokehold?
No.
Are they also consistent with putting your fingers into somebody's neck?
Yes.
Defense counsel asked why you hadn't included mention of a massage in your report. What was the cause of death indicated in your report?
I listed the cause of death as asphyxia due to blunt neck trauma.
And why call it asphyxia and not strangulation?
I used those terms specifically and not strangulation because strangulation has different meanings in different contexts. And to avoid any miscommunication or misinterpretation, I chose words that would be accurate and not exclude or limit interpretation.
Does asphyxia mean to either cut off the air or blood flow? Or what do you mean by asphyxia, I guess is the question.
Asphyxia means lack of oxygen. So in this case, lack of oxygen to the brain is what kills people. So lack of oxygen to the brain from blunt to neck trauma.
And what is a manner of death?
The manner of death, or
What is a manner of death generally?
the manner of death, is a medical legal category that we assign to deaths. Every state has at least 5 manners of death: natural, homicide, suicide, accident, and undetermined. So we have 5 categories to pick from for manner of death. Some states have 1 or 2 more. And the definitions of those and how to apply those guide what we assign to different deaths. So of those 5 categories, in this situation, homicide was the most appropriate manner of death.
And why is homicide the most appropriate manner of death in this case?
The injuries that she sustained most likely came about from the actions of another person. Those injuries resulted in her death, so that qualifies it for homicide.
And was that the cause and manner of death that you indicated in your report?
Yes,
Is that still your opinion on the cause and manner of death?
yes,
Do you believe that a deep tissue massage is a likely cause of the contusion to the back of Marcy's head?
Objection, no foundation.
Overruled.
Go ahead, Nancy.
Can you repeat?
Sorry, I sustain the objection to the request that what she believed. If you're asking her expert opinion, you need to rephrase the question.
In your training and experience, is a deep tissue massage a likely cause of the contusion that you observed?
No.
Why not?
The location of the contusion is, part of it is over a bony prominence, which is not a focus of a tissue massage. That's the first reason. The second is that if there is slow continual pressure of the tissue sufficient to cause bleeding in the muscles, I would expect there to be injury to the skin surface. And the third is that if deep tissue massages resulted in contusions of this nature, I would expect far more people to have contusions.
And how about any of the other injuries that you observed during the course of the autopsy? Do you think any of those could be contributed or attributed to a deep tissue massage in your training and experience?
No.
Objection, vague question, calls for narrative response.
So rule.
It's also a leading question.
I'll overrule the objection, all the answers can. Next step.
Did you observe a video of Ted West demonstrating the massage he allegedly gave his mother to law enforcement?
Yes.
Objection, Your Honor. I think I need to be heard on this.
Apparently I have to resolve an issue outside the presence. Close your notepad, wait there, chair, and discuss the case.
you observe a video of Ted West demonstrating the massage he allegedly gave his mother to law enforcement?
Yes,
Is that part of your case file?
yes,
Is that something that you reviewed in determining potentially what the causes of death? Or is that something that you reviewed in forming your opinion?
I did review it. I cannot tell you if I reviewed it before or after I issued the cause of death. In reviewing that video, it did not present me with information that I felt warranted changing the cause and manner of death.
Is that something that you would do if you received information that led you to a different conclusion?
Yes,
And in your training and experience, could the massage that you observed have caused the contusion to the back of the head that you observed?
No.
Why not?
because the location of it is over bony prominence, because the size of the contusion is consistent with tremendous force, and I would expect there to be skin changes. If there was sufficient force to cause bruising, there should be damage to the skin. And then the third reason is that if deep tissue massages caused such contusions, I would expect to see a lot more people in general with contusions.
Is the back of the head a place that Ted West indicated that he massaged in the video?
No.
And in your training and experience, could the massage that he demonstrated having done to his mother cause the hemorrhage to her carotid sheaths?
No.
Why not?
The region of the neck where the carotid sheaths are is uncomfortable to push on with pressure. There are a number of large nerves in that area that with pressure would elicit either extreme discomfort or pain. And then putting pressure on the neck in that region runs the risk of limiting blood flow to the brain.
Is the front of the neck where the carotid sheaths are an area that he demonstrated that he applied pressure?
No.
And how about the hemorrhage to the esophagus? Is there anything that he demonstrated having done that could have caused the hemorrhage to the esophagus?
No.
Did you see any injuries to the places where Ted indicated in the video he was applying pressure to his mother?
No.
No further questions on that topic here.
Any question for Leslie Alford, please?
Your Honor, I just have argument frame.
The argument.
So, Your Honor, the doctor did not rely upon this video to form her opinion. She's not even sure if she had it before or after she released her report. The officers came to my office on August 14th. This was 2 months after she had released her report, so she didn't have it when she wrote her report. So she didn't rely on it. That's number one. Second thing is, until this moment, I was not aware that it was shared with her or she'd be testifying about it. And it's not in evidence. So it's not something that she could be given as part of the evidence. So it might be rebuttal, but it is definitely not something for direct examination. So it's a discovery violation to feed her this well after I've talked to her, and now she's giving an opinion on what some other witness did in the case. So it's inappropriate, and it's not proper inquiry. It's not evidence in the court, Judge.
When did you speak to her? When did you speak to her?
March of 2024.
And when was this
No.
information about what Mr. West available?
So August of 2024.
So you're suggesting it's a discovery violation that you weren't able to ask her about something that happened 6 months later?
No, Judge, hold on a second here. So I interviewed her on March 28th, 2025. I'm sorry. And, but this is not something she relied on. It's not part of her, her file. It's nothing that was a subject matter for her. They've since given her that video for her to give an opinion. It's not in evidence. It's actually going to be a comment on another witness, and that's inappropriate as well.
Response?
Well, the only thing I would indicate, Your Honor, is that I didn't intend to get into the massage with this particular witness. In fact, I spoke with Mr. Walker during a break from the witness's testimony and said, is it okay with you if I go into the massage at this point so she doesn't have to take the stand again? He indicated, no, that would be objectionable because I haven't raised it yet. And so I said, okay, I won't. Sat down, and then he brought up the massage with her during cross. So all I'm doing is rehabilitating the witness at this point. And additionally, the massage has been brought in. She did rely on it, and she did not change her opinion. It's not a discovery violation.
But didn't you ask her about the massage?
I asked her about certain forces. I didn't say massage. I said if you gave a sustained, a sustained duration, hard force with your knuckles or elbow, could that cause that? At the time she said could.
Okay, are you suggesting, or are you planning on suggesting that this massage caused death or that it caused her injury?
It could have caused the tissue damage, but Judge, it's not been brought up yet. It's not, there's been no evidence that she had a massage. This might be rebuttal, but it's definitely not something for this testimony.
I sustain the objection at this point. Appears to be beyond the scope of what was brought up in the cross-examination. I will indicate if it's appropriate to ask an expert about other people's testimony and other things. So if you bring in a massage and are claiming that the massage either is a cause of death or a cause of injury, then she can come back up in rebuttal and explain why it is.
There should.
Okay, are you ready for the jury? Bring in the jury.
Dr. Burt, I'm showing you what has been marked for identification purposes as 146 through 150. And 260 taking this.
Okay.
And what do those depict?
These are photographs of her clothing taken after the clothing was removed from her body.
And do they appear to be true and accurate depictions of the clothing?
Yes.
Move to admit 146 through 150.
I'm sorry, Counsel, could I see that one more time, please? Thank you. No objection.
146 through 150 are admitted.
Right. First, move to publish, Your Honor.
Grant.
Great. Right. Dr. Burt, this is 146. What are we looking at here?
This is a photograph of her bra that was taken after it was removed from her body.
And is that how it appeared as it was removed?
Yes,
Is this an underwire bra or what sort of a bra is this?
it is an underwire bra.
And I know there's a little bit of blood there on the cup. Do you know what that was attributed to?
Not specifically, no.
Do you have any concern about blood?
I do not.
And why is that?
The amount of blood is very small. The distribution of it is consistent with passive transfer during disrobing of the body. And we do a set of photographs before we remove the clothing, and there was no blood in that location.
And also they're showing 149. Is this the sweatshirt that Marcy is wearing?
Yes,
And 150. All right, and it looks like there's a little bit of blood here in the kind of the armpit and the arm of the sweatshirt.
yes,
And do you have any concerns about that blood?
I do not.
And why so?
It appears to be passive transfer during the process of disrobing her.
So not necessarily from the time of her death?
No.
All right, now defense counsel asked about the glucose quite a bit. Why didn't you have NMS labs test for glucose?
The accuracy of post-mortem blood glucose is minimal. The blood glucose in any person rapidly changes after they die.
How rapid is that?
It starts falling within 30 minutes to an hour, and is usually undetectable within about 12 to 24 hours after death.
And defense counsel asked whether glucose levels could rise during vomiting. Remember that?
Yes,
Is that possible?
it is possible.
If Marcy had vomited around 11 p.m., what would you expect to see with regards to her glucose around 4:30 a.m.?
If she had, her body had initiated a stress response to the vomiting, I would expect that since assuming she did not continue vomiting, but that she returned to baseline, that her blood glucose would also return to a normal level.
And then again, seizure activity drops glucose even further.
In the immediate time period of the seizure, it does tend to drop blood glucose.
And it could rise after a seizure, correct?
Yes, yes,
But it has to be a naturally beating heart.
yes.
What do you look at to determine whether someone has a seizure disorder?
The information that I use to establish that diagnosis is the person's medical history and social history. A seizure disorder, chronic seizures, is based on historical repetitive seizures throughout a person's life.
Did you see any indication of a seizure disorder in Marcy's medical records?
No.
Did you see any indication of a seizure disorder in the history provided by her husband?
No.
Any other indications of a seizure disorder that you observed?
No.
Did you have your evaluation peer reviewed?
Yes.
What does that mean?
The peer review process that we use at Clark County involves having another board certified forensic pathologist review the autopsy report and associated documents for accuracy and clarity.
If they're reviewing for accuracy and clarity, do they also review to determine whether or not they concur with your cause and manner of death?
Yes.
And did you have this particular report reviewed?
Yes.
Who did that review?
Dr. Jennifer Nara.
Is she another forensic pathologist?
She is.
Can you explain again why there might be limited petechiae in the vascular strangulation?
With abrupt collapse of both the jugular vein and the carotid artery, there is very limited blood flow into the brain, into the face, so that there is not an appreciable rise in intracapillary pressure. The rise in the pressure, if it's sufficient, can cause blood vessels to rupture, which is then can look like petechiae, which are petechiae. So if you have sudden and sustained collapse of both the jugular and the carotid artery, there isn't the abrupt rise in capillary pressure.
And is petechia conclusive for strangulation?
No.
Is it corroborative of strangulation?
It can be.
And why didn't you cut each suspected petechiae spot out and examine it under a microscope?
The location of the petechiae would have resulted in devastating cosmetic damage. And so in weighing the usefulness of examination against my experience in training and interpretation, I did not feel that that was warranted, and that my diagnosis was sufficient.
Do families sometimes want a viewing of the deceased after an autopsy and eventual cremation?
Yes.
Now, defense counsel asked you about the injury to the back of the head being a hematoma. What is a hematoma?
Hematoma is one subcategory of contusions.
Okay. So a hematoma is a type of contusion?
Yes.
Okay. And are the photographs part of your record?
Yes.
And you have multiple photographs of this particular contusion, correct?
Yes.
How often would you say that you examine people who have undergone resuscitation efforts?
I estimate between 20 and 30% of all of the autopsies that I do, those people have had some form of resuscitation.
Have you ever seen this constellation of injuries in someone else through resuscitation efforts?
No.
And why didn't you send the brain for additional testing?
My decision tree involved, first of all, evaluating whether or not she had a chronic seizure disorder. In the absence of that diagnosis, the lesions of the brain that could result in an acute first onset seizure are things that I can diagnose during the autopsy. And so the utility of a neuropathologic examination was not necessary at that point.
But you still have tissue available,
Yes,
and somebody else could test that if they wanted to.
yes.
And defense counsel spoke to you about the life scan records a little bit. Is there anything after reviewing Marcy's medical records, including the life scan, that caused you concern that natural disease led to her death?
No.
I have no further questions at this time.
Hey, Doctor, you said you saw no evidence of a seizure disorder in her past, correct?
Yes,
But you didn't have any records showing any regular doctor visits or any testing for that, did you?
I did not.
Your records went back to 2016. There's nothing in there about that.
There was not.
Now, you said that you didn't want to cut any of the PQ because of cosmetic reasons? That is what you said, correct?
Yes,
Okay, and so cosmetics is more important than the accuracy of your report?
in weighing the utility, in weighing the information that I would have gained versus my confidence in my interpretation did not warrant pursuing that.
Do you know what the Lucas mark looks like? Because it's that kind of round area on the chest, correct?
Yes,
You didn't know what an EC hold was, issue that I asked you about, correct?
I'm not familiar with that term.
Objection beyond the scope.
How would you know if it's CPR related when you don't even know what the CPR steps are?
The mechanisms, the physical steps of CPR are fairly standard.
Well, yesterday when I asked you to tell me about any one of them, you just drew a complete blank, correct?
I cannot explain in detail all of the variations that might be employed.
So you said that you didn't send out the brain to the neuropathologist because it's something you feel you could have diagnosed yourself. You could have examined yourself.
The diseases and processes that could result in a first-time seizure are things that I can diagnose.
But you didn't.
I did not identify a lesion or pathology to explain a first-time seizure.
So Doctor, you were, the contusion on the back of the head, I'm just going to go back for a second. That was, the contusion is basically at the base of the skull, isn't it?
Yes,
Kind of where the bony part of the head gets into the soft tissue of the upper part of the neck, correct?
yes.
Go ahead, thank you.
No, Your Honor.
Subject
Subject to recall.
Yes.
to recall at this time, but you're subject to recall, so you, unless you're being asked to observe as an expert, you can't remain in the courtroom. You need to keep the parties advised of how to reach you and not discuss testimony with any other potential witness. Have all the exhibits been returned to the court?
I believe so.
Do you have any exhibits in your possession?
I do not.
All right, ladies and gentlemen, we'll take our morning recess. It'll be about 15 minutes.
Right.
Okay. Oh, no, don't worry.